the truth. They don't tell you about back pain surgery. Are you tired of waking up every morning with that same stabbing pain in your lower back? You've tried stretches, pills, maybe even physical therapy, and now your doctor's saying, maybe it's time for surgery. But before you go under the knife, there's something you need to hear. Because what if I told you that surgery isn't always the answer, and sometimes it can make things worse? Stay with me till the end, because this might just change how you think about your pain, and maybe even save you from unnecessary surgery. The hidden reality. Here is the truth most people never get told. Chronic back pain is rarely about a single fix. Most of the time, it's not just a slipped disc or a damaged joint. It's the result of years, even decades, of small issues stacking up. Poor posture from long hours at a desk, weak core muscles that stop supporting your spine, stress that tightens your back like a rope ready to snap. And yet, the first solution many doctors suggest is surgery. In fact, studies show that over 50% of back surgeries done for chronic pain lead to lasting relief. Many patients end up with the same, or even worse, pain after a year. It's called failed back surgery syndrome. Yes, that's a real medical term. Why surgery seems like the easy fix. When you're living with pain every single day, you get desperate for relief. You just want your life back, to walk, to sleep, to play with your kids, or sit without wincing. So when a doctor says, we can fix this with a simple operation, it sounds like hope. But here's the problem. Surgery often treats the symptom, not the source. Imagine your spine like a house. If one wall starts cracking because the foundation is weak, painting over the crack one might fix the real issue. That's what many surgeries do. They repair a disc or fuse a vertebra, but they don't strengthen the muscles, correct the posture, or retrain the body mechanics that caused the pain in the first place. And let's be honest, chronic pain doesn't just hurt your back, it hurts your mind. You feel trapped in your own body. You start to lose motivation, patience, even relationships. So when you're told that surgery could be your fresh start, it's almost impossible to say no. But listen carefully. Many people who went through back surgery report a temporary sense of relief, followed by frustration when the pain returns. The recovery is often long, painful, and costly, both physically and financially. And if the real cause of pain isn't addressed, it's like pressing pause instead of stop. Now, it's not just in pain, he is living with nerve damage and scar tissue that makes every step feel like fire. This isn't a horror story. It is a reality for thousands who go into surgery without understanding their body first. The hope you didn't know you had. But here's the good news. You are not broken. Your body is incredible at healing when you give it the right tools. Most chronic back pain can be reduced or even eliminated without surgery through correct movement and stretching routines, strengthening the deep, stabilizing muscles, learning how to sit, stand, and sleep in alignment, managing inflammation naturally through nutrition and hydration. You don't need a hospital gown, you need a healing plan. What's really causing your chronic back pain? If you've been living with back pain for months, maybe even years, and you still can't find the real reason why, listen closely. Because chances are, your pain isn't coming from where you think it is. You might have been told it's a disc problem or nerve issue or arthritis. But here's the secret most people never hear. The root cause of chronic back pain often has nothing to do with damage and everything to do with dysfunction. Let us uncover what's really going on inside your body, so you can finally start healing it, not just numbing it. Pain is not your enemy. It's your body's alarm system, a message saying, hey, something's out of balance here. But instead of listening, most of us try to silence that message with pills, injections, or endless bed rest. And what happens? The pain always comes back, louder. Because the body doesn't want you to mask it, it wants you to fix it. So before blaming your spine, let's look at the hidden chain reactions that could be fueling your pain right now. The silent culprit, muscle imbalance. Here is something shocking. Studies show that over 80% of chronic back pain is caused not by structural damage, but by muscle imbalance. Think of your spine as a tent pole. and your muscles as the ropes holding it upright. If one rope becomes weak or tight, the pole tilts. That tilt, over weeks, months, or years, puts constant pressure on the discs, joints, and nerves of your spine. Most of us sit too long, move too little, and stretch rarely. Your hip flexors tighten, your glutes weaken, your core loses stability, and your back takes all the load. So when you bend or twist, your spine ends up doing a job it was never designed to do alone. That's when pain begins, not because something broke, but because something stopped working properly. The modern lifestyle problem. Let us be real. Our bodies weren't made for 8 hours of sitting and scrolling. When you sit for long periods, your spine compresses, your core shuts off, and your shoulders round forward. Your brain starts to reprogram your posture until bad alignment feels normal. That's why people say, "But I didn't even injure myself. The pain just started one day." Exactly. It's not one day. It's every day adding up. Every hour slouched on the couch. Every night sleeping twisted. Every time you lifted something with your back instead of your legs. Your spine remembers every habit. The stress connection. Now, here is something that might surprise you. Emotional stress can tighten your back muscles just as much as physical strain. When you're anxious or tense, your body releases cortisol, your fight or flight hormone. And guess where it stores tension first? Your neck, shoulders, and lower back. That's why your pain might flare up more when you're stressed, overworked, or emotionally drained. Your mind and spine are more connected than most doctors talk about. It's not all in your head, but your head absolutely affects your back. The inflammation loop. If your pain comes and goes, and sometimes feels like it's burning or stiff, inflammation could be the hidden player. Poor diet, dehydration, lack of movement, all feed inflammation. Processed foods, too much sugar, and low water intake can make your back tissues swell and press on nearby nerves. So when you feel stiff in the morning or sore for no reason, it might not be aging. It could be your body as a way of saying, "Help me fight the fire inside." Nerve entrapment and the domino effect. Sometimes chronic pain isn't even about your spine. It's about your nerves being trapped or irritated by tight muscles. The sciatic nerve runs from your lower back through your hips and down your legs. If your piriformis muscle, deep in your buttock, tightens, it can squeeze that nerve, causing pain, tingling, or numbness. That S, why you might feel pain in your leg even though the real issue starts in your back. It's a domino effect. One muscle tightens, another overcompensates, and your entire movement pattern changes. The posture problem. We ignore. If you look at your reflection right now, shoulders rounded, chin forward, that's not just bad posture. That's a long-term setup for chronic pain. When your spine curves unnaturally, your discs are squeezed unevenly. Over time, that leads to herniation, arthritis, or nerve compression. Good posture isn't about standing straight like a soldier. It's about balance. Your head, shoulders, hips, and feet aligned in a way that lets your spine do less work and your muscles do more. The missing link, movement quality. You might think exercise is the answer, but here's the catch. Not all movement is good movement. If you train with bad form, you're reinforcing the imbalance that caused the pain in the first place. So before lifting weights or doing random YouTube workouts, learn how to move mindfully. Simple bodyweight exercises, gentle mobility work, and deep breathing can reprogram your nervous system. Because your body doesn't just need strength, it needs symmetry. The light bulb moment. So when someone says, "My MRI shows a bulging disc," that must be the cause. Remember this. Many people have bulging discs with zero pain, and many people with pain have perfect MRIs. That means the structure doesn't always tell the story. Pain isn't just about what's broken, it's about what's imbalanced. Your goal isn't to fix your spine, it's to restore harmony between your muscles, posture, and movement. When surgery is actually necessary. Let's be honest, when you're in pain every single day, the word surgery can sound like salvation. Finally, an end to the suffering, right? But here's the thing. Not every back needs a scalpel. In fact, most people who rush into surgery never needed it in the first place. So today, we were cutting through the confusion to reveal the real truth about when surgery is truly necessary and when your body just needs a different kind of healing. The reality check. Let's start with a fact that surprises most people. Only 5 to 10% of people with chronic back pain are true candidates for surgery. That's it. So why do so many people end up on the operating table? Because pain makes you impatient. When you've been hurting for months, even years, and nothing seems to work, you start thinking, maybe surgery is the only way left. But before you make that choice, you need to know the truth about what surgery can and can't do. What surgery can actually fix. Surgery can be a lifesaver when it's done for the right reason. There are specific conditions where the structure of your spine is so compromised that it physically can heal on its own. Let's break them down clearly. 1. Severe nerve compression. If a herniated disc is pressing hard on your spinal nerve, causing loss of leg strength, numbness, or bladder, bowel control issues, that's an emergency. In these cases, surgery like a discectomy can remove the pressure and prevent permanent nerve damage. 2. Spinal instability. When your vertebrae are slipping out of place, a condition called spondylolisthesis, or your spine can't hold itself upright, surgical fusion might be needed to restore stability. 3. Structural deformities. Severe scoliosis or spinal fractures that threaten your mobility may require surgical correction. 4. Tumors or infections in the spine. In rare cases, surgery is crucial to remove growths or infected tissue that are damaging the spinal cord. In short, surgery is for fixing structure, not chasing pain. When surgery is not the answer. Now, here's where things get tricky. Because pain doesn't always mean damage. If your MRI shows a disc bulge or mild degeneration and your doctor says, "Let's operate," pause. Why? Because those same abnormalities appear in people with no pain at all. Here's the uncomfortable truth. Some surgeries are done out of frustration, not necessity. When patients and doctors run out of answers, the knife becomes a shortcut. But shortcuts don't work with the human body. If your pain moves around, changes with stress, or improves with rest, it's not structural, it's functional, meaning your body is tight, weak, or imbalanced, not broken. No surgery can fix that. The risks they don't tell you. Let's talk honestly about the risks, because you deserve the full picture. Every back surgery carries potential side effects, scar tissue forming around nerves, which can increase pain. Reduced flexibility and spinal mobility, failed back surgery syndrome, where pain returns months later, infection or anesthesia complications. And here's the hardest part. Once you've had one back surgery, your chances of needing another go up dramatically. It's like opening Pandora's box. Every time you fix one area, it changes the mechanics of your whole spine. That's why even surgeons often say surgery should be your last option, not your first move. The red flags that mean, yes, surgery. Okay, so how do you know when surgery might actually be necessary? Here's a simple checklist of red flags. You have progressive weakness in your legs or feet. You've lost control of your bladder or bowels. Your pain is caused by a fracture, tumor, or severe structural issue. You've tried 6+ months of consistent non-surgical care, therapy, posture correction, exercises, and nothing has helped. If any of these apply, surgery may be the safest and smartest option. But, and this is key, if you haven't tried all natural, physical, and rehabilitative options first, you're skipping vital steps. The wait and heal approach. Many studies have shown that people who wait and pursue proper rehab before surgery often heal just as well, or even better, than those who rush into it. Why? Because your body is capable of adapting, rebuilding, and compensating when you move the right way. Things like core and hip strengthening daily mobility drills, reducing inflammation through diet and hydration, managing stress and sleep. These are not alternative solutions. They are the foundation of recovery. Surgery removes tissue. It doesn't restore function. Only movement and mindset can do that. A real-life story. 2 paths, 2 outcomes. Let me share a quick story. 2 people, same problem, herniated disc at L5-S1. Sarah, age 42, had pain shooting down her right leg. She panicked and had surgery within a month. The pain went away for 6 months, but then new pain appeared in her lower back because her core was still weak. Then there's Ahmed, 45. He took a different route, learned posture correction, started physical therapy, changed his chair setup, and worked on flexibility. After 6 months, his pain decreased by 80%, and he avoided surgery completely. Same diagnosis, different approach, different outcome. Surgery is not evil. It saves lives, restores function, and relieves suffering when it's needed. But it's also not magic. It won't fix years of poor movement, stress, and muscle imbalance. Think of surgery as a reset button, not a repair manual. You still have to rebuild your foundation afterward. That's why even after surgery, patients must do therapy, exercise, and lifestyle change, or else the pain returns. So before saying yes to surgery, ask your doctor 3 questions. 1. What's the exact cause of my pain? 2. Have I tried all non-surgical options for at least 6 months? 3. What happens if I don't get surgery? Right now? If the answers aren't clear, get a second opinion. You only get one spine, protect it. Now that you know when surgery is truly necessary, and when it's not, in the next part, we'll talk about the most important thing of all, how to heal naturally without surgery. We'll go step by step through movements, habits, and mindset shifts that can help your back recover, safely, naturally, and for life. Because the best surgery is the one you never needed. How to heal naturally without surgery. If you've been told that surgery is your only option, I want you to stop and take a deep breath. Because your story isn't over. Not yet. You might not believe it, but your body still knows how to heal. It just needs the right tools, the right habits, and the right mindset. Today, I'll show you exactly how thousands of people have freed themselves from chronic back pain, without surgery, without pills, and without losing hope. Let's rebuild your back, naturally, from the inside out. Healing starts in the mind. If you've been in pain for a long time, you've probably lost trust in your body. You wake up and think, it's going to hurt again today. That expectation alone keeps your nervous system in defense mode. Your brain literally tells your muscles to stay tight, your posture to stiffen, and your pain signals to keep firing. Science proves it. The body regenerates every single day. Even damaged discs can rehydrate, muscles can relearn, nerves can calm. It's not magic, it's biology. Your body isn't broken. It's just waiting for you to stop fighting it and start working with it. Movement is medicine. When your back hurts, your instinct is to rest, but rest too long, and your muscles forget how to move. Motion is lotion for your spine. Every gentle stretch, every small walk, every correct posture signal tells your brain, I'm safe to move again. Here's what you can start doing today. Gentle mobility. Begin with slow pelvic tilts, cat-cow stretches, and knee-to-chest movements each morning. This wakes up your spine and keeps it lubricated. Core activation. Forget sit-ups. They often make pain worse. Focus on deep breathing, planks, and glute bridges. Your core isn't just abs. It's your entire midsection working to stabilize your spine. Daily walking. A 20-30-minute walk each day improves circulation, releases endorphins, and trains your spine to move rhythmically. Walking heals more backs than most medications ever could. Start small. Even 5 minutes counts. Section 3. Fixing the root cause, posture, and alignment. You can't fix back pain without fixing posture, but good posture doesn't mean stand up straight. It means balanced alignment. Try this quick reset. Stand tall and imagine a string pulling your head toward the ceiling. Relax your shoulders down and back. Engage your core slightly and not tight, just supportive. Keep your weight evenly on both feet. Do this 5 to 10 times a day, especially when sitting. Your body learns by repetition, not by effort. Strength over surgery. The stronger your supporting muscles, the less pressure your spine feels. That's why strengthening your glutes, hamstrings, and core is non-negotiable. Here's a simple home strength sequence. Glute bridges, 15 reps. Bird dogs, 10 reps per side. Wall sits, 30 seconds. Side planks, 15 seconds per side. Repeat this 2 to 3 times a week. It might seem small, but over time it transforms your spine's foundation. Remember, surgery cuts, strength rebuilds. Healing through nutrition. You can't build a strong back on a weak diet. Eat more of these anti-inflammatory foods. Fresh fruits, especially berries and pineapple, leafy greens like spinach and kale, omega-3 sources like fish, walnuts, and flaxseed, turmeric and ginger for natural pain relief, sugary snacks, processed oils, red meats, excess caffeine or alcohol. Also, hydrate. Your spinal discs are 70 to 80% water. If you're dehydrated, your discs literally shrink, increasing stiffness and pain. Drink 2 to 3 liters of water daily. It's the cheapest therapy there is. Relaxation and recovery matter too. You can't heal if you're always tense. 5 minutes of deep belly breathing. Inhale 4, exhale 6, gentle spinal twist stretch in bed, warm compress or Epsom salt bath before sleep, and most importantly, sleep right. Your sleeping position can either heal or harm your spine. For most people, the best way is on your side, knees slightly bent, with a pillow between your legs. If you sleep on your back, put a small pillow under your knees. Never sleep on your stomach. It twists your spine all night long. Healing doesn't happen in one big breakthrough. It happens in tiny, consistent steps, daily. 5 minutes of stretching every morning. 1 healthy meal at a time. 1 posture check every hour. Every day you move, eat, and rest the right way, you're teaching your nervous system that it's safe to release pain. But one day your pain is gone and you realize you've rebuilt yourself from the inside out. Real people. He started fixing posture, strengthened his glutes, and swapped junk food for whole meals. 1 year later, no pain, no injections, no operation. The new you starts now. So ask yourself right now, are you ready to stop being a patient? You don't need to chase the next treatment or quick fix. You just need to commit to your movement, your food, your mindset, and your rest. Because the best medicine isn't a tea in a bottle or an operating room. It's in your daily habits. If you found this message helpful, don't keep it to yourself. Share it with someone you know who is struggling, someone who is scared of surgery or tired of pain. Because the truth is, back pain doesn't mean a broken life. You can rebuild, you can move freely again, and you can feel alive in your body once more. Your spine isn't your weakness, it's your core of strength. Treat it well and it will carry you, and you pain-free for the rest of your life.